So let's proceed to the physical assessment. So let's proceed to the general survey, which is the appearance. Usually men experience hair loss and both sexes develop gray hair and wrinkles. As the body fat atrophies, the body's contours gain a bony appearance along with the deepening of the hollows of the intercostal and supraclavicular spaces, and also in orbits and axilla. An elongated ears, a double chin, and the baggy eyelids are among the more obvious manifestations of the loss of tissue elasticity. And also, skin fold thickness is significantly reduced in the forearm and in the back of the hands. While the loss of subcutaneous fat content is responsible for the decrease in skin fold thickness, it is also responsible for a decline in the body's natural insulation, making the older adults more sensitive to cold temperatures. And a body's shrinkage is due to reduced hydration, loss of cartilage, and thinning of the vertebrae. Mental status. A reduction in neurons, nerve fibers, cerebral blood flow, and metabolism is known to occur. So, a reduced blood flow is accompanied by a reduction in glucose utilization and metabolic rate of oxygen in the brain. So, the nerve conduction velocity is lower, and these changes are manifested by slower reflexes and delayed response to multiple stimuli. Mm, there is a slower response to changes in balance, a factor contributing to falls, and the slower recognition and response to stimuli is associated with a decrease in new axon growth and nerve reinnervation of injured peripheral nerves. So for the brain cells, it slowly decline over the years. The cerebral cortex undergoes some loss of neurons, and there is some decrease in brain size and weight. Because the brain affects the sleep-wake cycle, circadian and homeostatic factor of sleep regulation are altered with aging. So for the assessment procedure, you have to observe for tremors and involuntary movements. So let's proceed to the organ system assessment, which is the skin. The flattening of the dermal-epidermal junction reduced thickness and vascularity of the dermis, slowing of epidermal proliferation, and an increased quantity and degeneration of elastin fibers occurs. So collagen fibers become coarser and more random, reducing skin elasticity. The dermis become more avascular and thinner as the skin becomes less elastic and drier and more fragile, and the subcutaneous fat is lost, lines, wrinkles, and sagging become evident. So for the skin, it becomes irritated and breaks down more easily. There is a reduction in the number of melanocytes in the melanocytes cluster, causing the skin pigmentation, commonly referred to as age spots. And there are more prevalent in areas of the body exposed to the sun. The reduction in melanocytes causes the older adults to tan more slowly and less deeply. The skin immune response declines, and it caused the older people to be more prone to skin infection. So for the hair, the scalp, pubic, and axillary hair thins and gray due to the progressive loss of pigment cells in the atrophy and the fibrosis of the hair bulbs. Hair in the nose and ears become thicker. Growth rate of scalp, pubic, and axillary hair declines. The growth of facial hair may occur in the older woman, and an increased growth of eyebrow and nostril hair occurs in older men. Perspiration is slightly reduced because the number and function of the sweat glands are lessened. For the skin and hair assessment procedure, first is inspect and palpate for skin lesions. Wear gloves when palpating lesions. Note whether lesions are flat or raised, palpable, or no palpable. Also note color, size, and exudates, if any, and note for color, texture, integrity, and moisture of the skin and sensitivity to heat or cold. And inspect the scalp and hair. It is part of the assessment. For the nails, fingernails grow slowly, fragile and brittle, develop longitudinal striations, decrease in lunula size. For the head, the eyes, and vision, presbyopia, it is the inability to focus or accommodate properly due to the reduced elasticity of the lens. It is a characteristic of the older eyes and begins in the fourth decade of life. So the pupil is less responsive to light because the pupillary sphincter hardens and the pupil size decreases and the rhodopsin content in the rods decreases. Also in the blood supply of the retina and retinal pigmented epithelium can cause macular degeneration, and it is a condition in which there is a loss in central vision. The density and the size of the lens increase, causing the lens to become stiffer and opaquer. Opacification of the lens, which begins in the fifth decade, um, leads to the development of cataracts, which increases sensitivity to glare, blurs vision, and interferes with night vision. And a less efficient reabsorption of intraocular fluid increases the older person's risk of developing glaucoma. Corneal sensitivity is diminished, which can increase the risk of injury to the cornea. The vitreous decreases and the proportion of the liquid increases, causing the vitreous body to fall away from the retina, and the blurred vision, distorted images, and flutters may result. Eyes and vision assessment procedure. First, inspect the eyes, eyelids, eyelashes, and conjunctiva. Observe the eye and conjunctiva for dryness, redness, tearing, or increased sensitivity to light and to wind. Inspect the cornea and lens. Ask the client when he or she last had an eye vision examination by an optometrist or ophthalmologist. Inspect the pupils, and with a pen light or similar device, test pupillary reaction to light. Then test vision. Ask the client to read from a newspaper or magazine. Use only room lighting for the initial reading. Use task lighting for second reading. Ask the patient about changes in vision, trouble with night vision, or differences in vision with left versus right eye. Ask the client about small specks or clouds that move across the field vision. The ears and hearing. Presbycusis. Presbycusis is a progressive hearing loss that occurs as a result of age-related changes to the inner ear, including loss of hair cells, decreased blood supply, reduced flexibility or basilar membrane, degeneration of spiral ganglion cells, and the reduced of production of in the lymph. And the acoustic reflex, which protects the inner ear and filters auditory distractions from sounds made by one's own body and voice, is diminished due to a weakening and stiffening of the middle ear muscles and ligaments. In addition to hearing problems, equilibrium can be altered because of degeneration of the vestibular structures and atrophy of the cochlea organ of the corti and stria vascularis. For the ears and hearing assessment procedure, first is to inspect the external ear, observe shape, color, and hair growth, look for lesions or drainage, perform an orthoscopic examination to determine quantity, color, and consistency of the cerumen, and perform the voice whisper test. This is a functional examination to detect obvious conversation hearing loss. For the nose and sinuses, a connective tissue changes cause a relaxation of the tissue at the lower edge of the septum. So, the reduced support causes the tip of the nose to slightly rotate downward, and the septal deviations can occur as well. For the nose and sinuses assessment procedure, first is to inspect the nose for color and consistency, evaluate the sense of smell, have the client close the eyes and smell a common substance such as mint, lemon, or soap. Test nasal patency, ask the client to breathe while blocking one nostril at a time. For palpation, palpate the frontal and maxillary sinuses for consistency and to elicit possible pain. Safety tip. Older adult clients with nasogastric feeding tubes are at increased risk for sinusitis related to the obstruction. For the mouth and oropharynx, mouth breathing during sleep becomes more common as a result, contributing to snoring and obstructive apnea. So the submucosal glands have decreased secretions, reducing the ability to dilute mucous secretions. The thicker secretions are more difficult to remove and give the older person a sensation of nasal stuffiness. For the assessment procedure, first is to inspect the gums and the buccal mucosa for color and consistency. If the client is wearing dentures, inspect them for fit and ask the client to remove them for the rest of the oral examination. Examine the tongue by observing the symmetry and the size, then observe the client swallowing food or fluids. Test for the gag reflex where you depress the posterior third of the tongue and note gag reflex. The lungs and the thorax. The calcification of costal cartilage makes the trachea and the rib cage more rigid. The anterior-posterior chest diameter increases, often demonstrated by kyphosis, and the thoracic inspiratory and expiratory muscles are weaker and in the lungs. Cilia reduce in number and there is hypertrophy of the bronchial mucus gland, further complicating the ability to expel mucus and debris. Alveoli reduce in number and stretch due to progressive loss of elasticity. It is a process that begins by the sixth decade of life. The lungs become smaller, less firm, lighter and more rigid, and have less recoil, and a maximum breathing capacity decreases. For its assessment procedure, inspect the shape of the thorax, note respiratory rate, rhythm, and quality of the breathing. For percussion, percuss lung tones as you would in a younger adult. For auscultation, auscultate lung sounds as you would in younger adult. The cardiovascular and peripheral vascular system. A heart size does not change significantly due to age. Rather, enlarged heart are associated with cardiac disease and marked inactivity that can cause cardiac atrophy. So there is a slight left ventricular hypertrophy with age. And the aorta becomes dilated and elongated, and also the atrioventricular valves become thick and rigid as a result of sclerosis and fibrosis, compounding the dysfunction associated with any cardiac disease that may be present. So there may be incomplete valve closure resulting in the systemic and diastolic murmurs. And an extrasystolic sinus bradycardia and sinus arrhythmia can occur in relation to irritability of the myocardium. Throughout the adult years, The heart muscles loses its efficiency and contractile strength, resulting in reduced cardiac output under the condition of the physiologic stress. The pacemaker cells become increasingly irregular and decreased in number, and the shell surrounding the sinus node thickens. The isometric contraction phase and relaxation time of the left ventricle are prolonged. The cycle of diastolic filling and systolic emptying requires more time to be completed. So the middle layer, the tunica media, undergoes a thinning and calcification of the elastin fibers and an increase in collagen, which causes a stiffening of the vessels. And an impaired baroreceptor function and increased peripheral resistance occur, which can lead to a rise in systolic blood pressure. The outermost layer, the tunica adventitia, is not affected by the aging process. Decreased elasticity of the arteries is responsible for vascular changes to the heart, kidney, and pituitary gland. Reduced sensitivity of the blood pressure, regulating baroreceptor, increases the problems with postural hypotension and postprandial hypotension, or a blood pressure reduction of at least 20 mmHg within 1 hour at eating. For the heart and blood vessels assessment procedure, measure blood pressure, take blood pressure to detect actual or potential orthostatic hypotension and therefore the risk for falling. Measure the pressure with the client in lying, sitting, and standing position. Measure pulse rate, have the client lie down for 5 minutes, and take the pulse and blood pressure at 1 minute. Take the blood pressure and pulse after the client is sitting, and again after the client stands. For the pulse assessment procedure, determine the adequacy of the blood flow by palpating the arterial pulses in all locations: carotid, brachial, the radial, femoral, popliteal, posterior tibial, and dorsalis pedis for strength and quality. And for the safety tip, palpate carotid arteries gently and one side at a time to avoid stimulating vagal receptors in the neck, dislodging an existing plaque, or causing syncope or a stroke. Arteries and veins assessment procedure. First is to auscultate the carotid, the abdominal, and femoral arteries, evaluate arterial and venous sufficiency of extremities, elevate legs above the level of the heart, and observe color, temperature, size of the legs, and skin integrity. Also inspect and palpate veins while client is standing. The heart and assessment procedure. Inspect and palpate the precordium and auscultate the heart sounds.